Admitted everybody here. I want to thank everybody for joining us today. We'll wait a little bit and let everybody get joined in here and get everything going. And everybody as they come in. If you can, just add in the chat, just so that everyone can kind of familiarize themselves with the Zoom and everything like that. If you can post in the chat kind of where you're from, if you have any questions here at the beginning, you can go ahead and type those in. If you did email those out to us, we do have a list of those. We are going to go through, as many of those at the end on a Q&A session and probably answer some of those questions throughout the actual presentation as well. But yeah, we'll just keep waiting here for just a minute longer. Want to make sure that we just have everybody in that is getting joined in there. So we'll keep admitting people on that. And again, if you haven't been in here for a second, feel free to comment in the chat where you're from. Just so you can familiarize yourself with that. And then if there's, for anything, any questions that you have, you can put those in that chat as well. We have a list of questions that people have submitted prior, and then we also we'll try to get to as many live questions as we can as well. It looks like we are there, got quite a few in, looking good there. I think that we can probably go ahead and start. Just to start off, my name is Jordan Bond. I'm one of our new patient advocates. I will be co-hosting with Dr. Adams on this. We'll be going over ADHD and the mind-eye perspective on that. Dr. Adams, if you want to go ahead and introduce yourself and start up your presentation, I think that we've waited long enough and we've got everybody in here.
Okay. Well, my name is Dr. Adams, as you said. I've been with the Mind-Eye Institute for over 5 years. I'm director of Visual Rehabilitation. And I'm glad to see so many people from so many different locations joining in tonight. And that just goes to show you how interesting this topic is. And I hope you find it very educational. Specifically, we're going to discuss ADHD and how we care for our patients with this diagnosis. And we're going to have some real life case examples at the very end. And I can't wait to share those cases with you. You're going to see firsthand how these patients are doing. So hopefully it'll generate a lot of questions, and I will answer some of the questions during the presentation and then others at the end. So let's get started. A little bit about myself. So here is a list of some of the discussion points that we're going to have. And we're going to go over what ADHD is and look at some statistics that go along with that. And we're going to tell you a little bit about ADHD and visual processing and talk about what we do at Mind-Eye that's different from some other places and how we've had success with treating this condition. Again, some case studies. And at the very end, I'm going to be happy to go over some of our success rates with you. Let's start by going over a working definition of what ADHD is. It's basically a brain dysfunction, and it manifests in both children and adults, even though oftentimes adults have developed coping mechanisms until something happens and they can no longer cope. That might be a brain injury, or it could be an illness, could be anything. But it doesn't matter if you're a child or an adult. the way ADHD manifests has some common traits. So you might notice a person has difficulty with focus, or they're hyperactive, or they're very impulsive. So here at the Mind Eye Institute, our innovative approach is designed to improve, and I'm going to give you the secret sauce. We are working on peripheral processing and sensory integration as a means to combat and overcome things that are related to ADHD or symptoms related to ADHD. That involves some traditional tests, using a patented BZ-Bell test, using our Brainwear eyeglasses, some activities that we send you home with. But ultimately, all of that stuff combined, what we want for our patients is for them to perceive the environment in a less confusing manner. That was a lot of data for that short slide, wasn't it? Basically, there are roughly more than 10% of the children in the United States that suffer from ADHD, and over half of them have a severe case of it, moderate to severe. And the reason this is such an important topic is ADHD often comes along with a lot of comorbidities, which includes anxiety, depression, and learning problems. So the sooner we can get this under control, the more likely we are to set children up and adults up for success. So what I want to do at this point is I want to go over some of the symptoms you will see in a person who has ADHD. And I want to contrast that with some of the symptoms you see with a person who has a visual processing problem. So I'm going to ask you just to take a moment and type in what you think I'm going to list as symptoms of ADHD. So whenever you think of ADHD, what type of behavior do you equate that with? So I'm going to look and see how many people respond and what kind of symptoms you're used to seeing. Someone just typed in focus. They couldn't get that one in fast enough. Anybody? Impulsivity, good one. That's what I have. Hyperfixation, attention span. Those are all very good. So let's see what I came up with. And this is by no means an exhaustive list. Oh, not being able to read social cues. Here we go. Difficulty concentrating. So I agree with that one. And this again is by no means comprehensive, but it's a high level list of symptoms. Restlessness and fidgeting. Trouble following instructions. Did anyone think about organizational skills or lack thereof? And avoidance of tasks that require sustained mental effort. So those are just some of the things that you think of whenever you think of ADHD. Now, we're going to move on to visual processing problems. So we're trying to decide what kind of behavior would you see in a person who has ADHD, and what kind of behavior would you see in a person who has a visual processing problem? Lo and behold, you're not going to believe this, but check it out. They're exactly the same. So the symptoms you encounter in people with visual processing problems, same as the ones you encounter in people who have ADHD type of problems. In fact, there was an article in the New York Post dated May 14th, 2025, that states before parents agree to put their child on ADHD medication, they should consider a functional vision exam, because you really want to make sure your child has a healthy eye-brain connection. Otherwise, you may be thinking your child has ADHD when in fact they could have something like convergence insufficiency, which is a specific type of visual processing disorder. So the next thing we're going to do is we want to talk about what we do at the Mind Eye Institute that addresses this condition. So we do a lot of traditional tests, but there are some things we do that are non-traditional. And one category is peripheral. We check your peripheral processing, and we also check for sensory integration. Loosely speaking, peripheral processing is important because it determines where you are in space and where other things are in space. Your peripheral grounds you. If it's not working well, it can affect your balance. You might be a little bit more clumsy. You might be prone to motion sickness, have poor scanning, not be able to focus or concentrate. So we need to make sure that our peripheral processing is intact. This has nothing to do with having an eye disease. It's a functional issue. So it's not a disease that you would see if you ran an MRI scan, for example, or you did a field of vision test where you sit in front of the visual field machine. It doesn't, those things don't pick up this type of behavior. On the other end, we also work very hard to make sure that our patients' sensory systems are all, as many as we can, working in tandem. So the sensory systems are various parts of the nervous system. And again, you want them working in unison. If they're not, you get fragmented attention, you fragmented behavior, you may even get light and sound sensitivity, or you may call it sensory overload. So let's focus a little bit on peripheral eyesight. This is a slide that basically is meant to emphasize that peripheral eyesight is not something you have to think about. It works beneath your conscious level, and as long as it's working properly, you're in a good place normally. But it's like breathing. You don't think about your breathing, you don't think about your throat unless you're having trouble. Like you have a sore throat, that's all you can think about. Whenever you have disruptions where connections are not what they should be, then all of a sudden you're thinking about your peripheral eyesight. It's no longer subconscious. And I cannot tell you how many people in this day and era will come here and say, you know what? My peripheral eyesight doesn't work well. 20 years ago, I never heard that. So I don't know if we're doing a great job as a field, as a profession of letting people know how important this is, or if it's in the media a lot, but a lot of people are now aware that if their peripheral eyesight isn't working well, they can't function well either. Oh, I like this slide. This is a very important slide. Basically, what it shows you is that when it comes to your peripheral eyesight, it's all about where you place your attention. Where is your habit? And if you look at this line here, ideally, you want to be in the center. You want to be balanced. However, if you're on this end, the pen light side, then these are people who have shut off their periphery. It's not something you knowingly do. People who have shut off their periphery will need to have their periphery awakened. This is the person who you will see who hyperfocuses. And it's just the opposite of the person on the other end who's in floodlight mode, that scattered mode. It might be internal, where their thoughts are all over the places, or it may be external, or even both. And you all know what a person who's in the floodlight mode will look like in real life. They're all over the place. That's the child who you're trying to do an eye exam and their head is in the seat and their butt is in the air. So, or they're running around and you can't get them to sit still, or you ask them to look at something and they can't look for more than a few seconds. So these are real issues, and it really impacts a person. Doesn't matter which way you're seated, if you're here or here, either one can be very disruptive. Giving you a little bit more information about this. What type of behavior do you think you would find in someone who is in the pen light mode? So I'm going to ask you, if you know of someone who's in the pen light mode, Have you noticed any type of behaviors that you think, that's odd? So no one's typing, so I'm going to go ahead and throw it out there. People who are in the pen light mode, they like peripheral awareness. They bump into things, they scare easily, they have anxiety. You might have trouble driving, may make more head movements. When you're reading, you skip around, you lose your place. Hard to be on escalators, have poor facial recognition. So that's one end of the spectrum. On the polar opposite end of the spectrum, where the periphery is turned on too much, these are people who tend to be, they don't focus well, they don't shift their attention well. And it's not uncommon that after a brain injury, you actually get stuck in this mode over here. And you have a lot of light and sound sensitivity. And if I was going to stereotype people, which you shouldn't do, I would say people on this end are more oftentimes on the autism spectrum, and a lot of our brain injury patients are more on this end. Here in the center, you have the neurotypical person, but what you want is you want to be able to move, because sometimes you do want to hyperfocus, but you don't want to be stuck there. You want to come over here. Sometimes you want to be a bit scattered. You want to be aware of the big picture and what's going on around you. But you don't want that to be all day long, where every little sound captures your attention. So we have to be able to swing here. We need that flexibility with mostly being here. And before I leave this slide, I want to leave you with one more little nugget, which is people who come to us with ADHD oftentimes have 20/20 eyesight. It's just that their retinal processing is dysfunctional. What I really want to get to is I want to share our success rates with you. But before I do that, I want to go over the next category, which is sensory integration. And here was a slide of the importance, what it's meant to show is the importance of a strong eye-ear connection. So you want the audio processing maps what's coming in through your ears, and visual processing is mapping what's coming in through your eyes. And you want those two sensory inputs to be coordinated. And if they are, it can even enhance your motor output. So I'm going to take a little detour and say that it's whenever you have a good connection between your sensory systems and they overflow into other systems, you will see a change in a person that you could not have possibly predicted. For example, I can't tell you how many times we've built up these connections and a child will come back and say, guess what? I'm riding my bicycle without training wheels for the first time. Or I'm catching a baseball when I could never catch a ball before. So you see this sensory integration, even though we're working with these 2, 3, 4 sensory systems, maybe touch, maybe proprioception, or it could be the bells or the auditory, or we're moving we're shifting your hips, or we're working in different illuminations. We're doing all these different things to make sure we're getting to the periphery and getting it working as well as we can. And we see overflows in many, many other areas in a person's life. What surprises me about this slide, or at least it used to and no longer does, is that there is a strong eye-ear connection. And here we have a study that was done by Duke University where they did research and came to the conclusion that there are connections between the eyes and the ears and even the vestibular system. But for anyone who doubts this, just do a Google search and you too can find that the connections are real and they do exist. And when they're disrupted, then you run into problems. that mimic ADHD. It's important that we address ADHD as quickly as we can to set patients up for success. People who are left to struggle often run into other barriers in their life because ADHD doesn't travel alone. You find oppositional behavior, and oh my gosh, learning disabilities, that's a big one. Poor reading comprehension. As you get older and you're trying to self-medicate, possibly substance use and abuse, anxiety, mental disorders, OCD, and mood disorders. So that's why it's so important that we help as many people as we can. And honestly, even though we're mentioning children, this goes for children and adults. When it comes to tackling ADHD, I wouldn't say that it's one profession that helps more than the other. I think that it takes multiple professions oftentimes. It takes a village. So we are often in close contact with teachers. We get a lot of referrals from educators. I had a referral from an educator recently where she actually wrote me a personal letter telling me what she had been struggling with a child. Can you imagine that kind of commitment from a teacher? You better believe I wrote her a personalized letter at the end of that exam. I was so impressed. Aside from teachers, we have pediatricians. So pediatricians are very much on the forefront. I would stress that before putting a child on medication, though, we exhaust all our options. Counseling is very important, whether that's a school counselor or independent counselor. Occupational therapists and physical therapists play a role. And of course, we can't leave out optometrists. And yes, this slide shows an optometrist examining a patient. You will be surprised to see that not all our patients are in chairs. Some are in strollers, wheelchairs, and we have to sometimes come to you. That may mean on the floor. We're moving right along. So next, we're going to go over some actual patients. These are very recent patients. We decided to do this webinar about a month ago. And so I literally just went to the staff and said, who are 2 patients who were here recently with ADHD? And this is the result. So this is very recent data. The first person is Joel. His parents had him come in because, in their words, he had classical ADHD. He was examined by my colleague, Dr. Weil, and I'm just so impressed with the results that here we go. Oh, and we're not going to overlook Macie. She'll be second, and she has both ADHD and learning delays. Now, Joel, as you will see, also has learning issues, but the parents did not list that as the primary goal. Their primary goal was to help their child overcome ADHD. Their secondary goal was to help their child overcome ADHD. And their third goal was to help their child overcome ADHD. Because without that, he really couldn't learn. So here we have a child, 7 years old. He has ADHD. He's on the spectrum, been exposed to pandas. He was highly active during the exam. Read that into it what you may. He was struggling with sensory overload. His parents stated his speech was unusual. He couldn't pronounce certain words. He was having difficulty learning to read, and following instructions in a classroom was almost impossible. He had already been in a visual therapy program in his hometown. And I did note, because we did a webinar recently on speech, but his vision therapy program helped with his speech development. They did see some improvement there. So an applause for that. He was having difficulty walking. One of his feet would turn to like 45 degrees off and it would drag. Again, trouble following instructions. They had successes with other interventions because it takes a village, just nothing was really helping enough. There was a note during the exam that his eyes were slow to focus. One eye was being suppressed, which means the brain would just turn it off randomly and just use one eye. And if you were to move something around, he wasn't even aware of the movement. Kind of, I use the word disjointed in cases like this. A lot of things was just not put together and connected the way it should have been. So struggling. What do we do? What do we do differently? Because he's already been to OT, PT, speech, physical therapy, vision therapy. This is a 7-year-old who's been through a lot of therapies. And to the parent, I will say something to this accord usually. Usually I say something to the effect of, let us do what we have to do, and everything you've done in the past will not be for naught. In other words, everything you did to the past is really going to come into play, and you're going to get a nice consolidated child. Again, this wasn't my patient, so reading the notes from the Dr. Weil, our newest optometrist, she prescribed some mind-eye eyeglasses, which encouraged a reliable eye-ear connection using a patented Z-Bell test. In this case, the prescription was written so that the light entering the eyes favored one side of the brain more than the other. So as he's wearing these therapeutic glasses, she's stimulating the side of his brain that's most receptive to change. And he was given some homework. So the big reveal, what changed? What do the parents say either on the first phone call where we check in with you or on the next visit or both? So many things changed. I literally had to stop writing because I had run out of space and I want to keep this to one slide. So here are some of the highlights for our 7-year-old patient who could not sit still in the chair, who could not even look at a target so we can check his eye movements. Some of the things that the parents said on the first phone call was the minute he put his glasses on, there was an immediate improvement, as if a light switch had turned on. His speech improved. Not only did his speech improve, but he started singing. The fear mode that he had been trapped in vanished. He began to recall things, memories. He had a stimming behavior, which is, see stimming with autism. That became almost non-existent. After 2 years of not being able to walk well, he now has a normal gait. And keep in mind, he's had 2 years of PT. He's able to order his own food. And for anyone who doesn't have a special needs child in their life or a special needs person, you don't understand what other families go through. This family was so overwhelmed that their little boy could now order his own food when he went to a restaurant. He was able to play baseball, which means he's going to be able to develop social interactions with other children, which will potentially combat some of those possible behavioral changes we talked about earlier, like substance abuse and oppositional behavior. And he could never understand numbers, and now he can use numbers. So things that we take for granted. And all we did was indirectly help him with his ADHD type symptoms. And it could have been visual processing symptoms too, because we said he was suppressing one eye. And there's a lot of overlap between the two. So instead of saying what changed, the question becomes what didn't change, because there were so many things to choose from. And that's not even the whole list. And he has not had a second visit yet. The next patient. This was an 8-year-old patient with ADHD. But unlike the first patient, whose family was like, just fix the ADHD, everything else, if we get it, that's gravy on the extra, but we don't have to get it. In this case, the parents like, you know what? Our child has ADHD, which is a big concern. She has trouble making decisions, executive functioning, but she's also having trouble learning. This was a cutie, this little girl was. She was in the first grade, very creative, very wiggly, butt all over the chair. Memory does not exist. Her penmanship, it was just, she couldn't even hold a pen or a pencil correctly, and a lot of anxiety. She had already been in occupational therapy, and they were helping her with the grip, just not maybe having much success. She was in tutoring 3 days a week. That's a lot. She's already been through vision therapy, and she had some reading glasses, which the parents stated were helping her. So she got her mind eye brainwear, her eyeglasses, and this is what the parents noticed. Per the mom and the tutor, she became more focused. Her executive functioning, her decision-making ability got a little better. And they applaud the fact that she became organized and she could pack her own lunch in her own book bag. She began to read better. She wanted to try new things. And she wasn't so aware of her surroundings. In fact, she could just sit still and focus. And then the parent said, so what kind of changes should I look for? And to me, I'm just like taking my palm and hitting it against my forehead. I'm thinking all this good stuff. And you ask me what you should look for? Okay. So with her glasses, we also gave her a prescription where we push light more to one side of the brain than the other. So we can either prescribe prisms, we can prescribe lenses that act like prisms. We can sometimes give a person special tints in their glasses or tinted glasses. Some of the things that we do in addition to that are the home activities. Or you may even see children with what we call filters on their glasses, which means it's like a little neutral density filter, a little piece of tape where you put it on the glasses to dampen pathways that are not working well. We have so many things in our toolbox that we choose from. That's just some of them. So now for the big reveal. Our success rate. This data was taken from our patients. We had a sample size of 500 respondents. And what it shows is nearly 89.9% of our patients with ADHD improved. The vast majority improved within 2 visits. And then we had another large chunk by the 3rd or 4th visit, with a minuscule by the 5th or 6th visit. So we really are proud of the stats because we went into this not knowing what type of data we would recover when we ask our patients, did you see some type of improvement in you or your family members' ADHD type of behavior? So this is a pretty good track record. For those of you who, if you should come for this reason, I would caution you to know that it is a commitment. There are ups and there are downs, but as long as the trajectory is up, we're happy with that. And it typically takes a year or two for a person, and they usually come, 2-3 times a year. With that being said, an overall summary is ADHD comes with a certain type of behavior, which we've all seen or we are familiar with. It's very common. I oftentimes wonder if that 10-11% range is an understatement. There are many people who are not diagnosed, and some are diagnosed later in life, sometimes after an injury. There's a lot of overlap between ADHD and visual processing problems, and I wonder if you can always separate them. I don't think you can. Since our approach is unique, where we are focusing on the peripheral eyesight and the sensory integration with the auditory and the visual, we tend to get really high success rates, and that's where the 89.9% response comes from. So I think conventional eye exams are very important, but sometimes we need more, or a person will need more. And with that, we look into what we do differently, whether it's assessing the eye-ear connection using standardized eye tracking equipment or hand-eye coordination or visual processing and sensory integration. And here you have our team of optometrists with Dr. Weil on the end, and the first patient was hers, and Dr. Zielinski and myself following or in front of her. So now I think would be a great time to open up for some questions.
Perfect. Yeah. Well, thank you for that, Dr. Adams. We really appreciate that. That was a fantastic presentation and very encouraging with results and uh, everything. Um, I do want to be cognizant of time and everyone else's time as well. So we will try to get through as many of the questions as we can. We did get quite a few for this webinar. We're going to go through and do kind of a mixture of the questions that have been coming in live through this chat, as well as the ones that were sent in previous to the actual webinar. So we'll start going through those. We'll try to get through as many as we can. And if we don't get to your question, please, if you didn't submit anything through an email, you can send that to us in an email at info@mindeye.com. Or you can also just reply to it in this chat with your email, and we can get back to you that way as well. So whatever's easiest for you. But we'll go ahead and jump right in here and try to get through as many of these questions as we can. Wanted to start off with a previous question from Claudia. She had a question about helping her dyslexic child who most likely has ADHD as well. What would you say to that, Dr. Adams?
What I would say to that is what we found with dyslexia is there's oftentimes an imbalance between their eye-ear connection. So I think I mentioned this in the presentation, but let me just do it again. So we address the auditory perception, and we want to link that with the visual perception of space. So we want to link those two perceptions of space. And once you get that continuity, then you can oftentimes see a change in dyslexic behavior or ADHD. So even if it doesn't cure it, it may make it better and easier to learn.
Okay. Okay. I think that goes into our next question as well with Allison, and she talks about with the difference between audio and visual processing. Are they interconnected?
Yeah, they
How
are.
does
So
yeah,
again, audio processing maps what's coming in through your ears. Visual processing maps what's coming in through your eyes, and you want to have both of those coordinated. So that's why we use the Z-Bell test, because whenever you have the two working in unison, then the sensory inputs actually influence a lot of things, including motor output.
got it. So bodily coordination, instruction in athletics,
Mm-hmm.
things like that as well.
Mm-hmm.
Okay. Okay. Perfect. Well, next question's from Sandy. Um, she's asking what's happening when she's looking right in front of looking for something, it's right in front of her, and she's not able to see it. I'm assuming that has something to do with some of the things that you talked about prior.
It does. What's happening in a case like that is if you remember the slide that I put up with the pen light and the flashlight, it sounds like you, Sandy, as if you're getting stuck in that pen light mode. And now you know firsthand what it's like because you have no conscious awareness that is happening, but there's something right in front of you and you can't see it. So you've lost your periphery. You're not scanning properly. So if you can't scan and take in the whole gestalt and you're stuck on little itty bitty snippets of space, then you can't see what's right. You will see what's right in front of you, but you won't be able to identify it. You can't see things that you think you should be able to, which once again proves how our periphery grounds us. It
Mhm.
helps us be aware of where things are in space and where we are.
Okay. Okay. Actually, I really like this question. can the mind eye glasses help with resistance to completing undesirable tasks?
Okay, that is a good question. And to that, I would say there are parts of the optic nerve, those fibers leave the eye and they travel to the limbic area in the brain, which among other things can indirectly influence motivation. In addition to that, we know that there are dopamine receptors in the eye, and light can increase the dopamine receptors. So we just mentioned two possible ways that you can have an impact from optometry on motivation, because you're right. But you do need a good amount of dopamine. Light stimulates that, and we do want to tag in or tap into your limbic system too to keep yourself motivated and wanting to do things and optimistic. So yes.
Awesome. Yeah, I think we actually talked a little bit about that on our last one, some of the non-image forming retinal pathways.
Yep. So the brain reward circuitry is very much tied to dopamine, and light activates dopamine. And what are we doing with our Brainwear glasses? We are manipulating light.
Good. Next question is going to be from Jodi. I'm just going to read this one. I suspect I have had some type of visual processing issue since childhood. I didn't have a need for glasses until high school, astigmatism and nearsightedness, yet reading has always been very taxing for me. I started researching online some years ago and found out so much of the information on convergence insufficiency definitely resonates with the issues I've experienced over the years. It wasn't until I came across your site that I found I can also identify with many questions on the ADHD and ASD questionnaires. I'm in the process of going back to graduate school and really would like to gain some perspective. Can you talk a little bit about some of the, convergence insufficiency and how that plays a factor into, a lot of patients with ADHD and ASD?
I would say, Jodi, you are not alone. A couple of hours ago, I just had a patient come in, and her entering concern was that she had dyslexia. And she said, I'm here because years ago, my sister came here, and my sister was really struggling in undergrad school. And she came here, got treatment, and she's so much better that she was able to finish a master's degree. And now I'm really struggling with the same thing, and that's why I'm here. And now here is Jodi saying the same thing. So it sounds to me, Jodi, since you've struggled for so long, that you've had visual processing issues since you were small. And the first sign of that was whenever you started to develop astigmatism. And that was your brain's way of trying to figure out how to process what you were seeing and was having trouble doing it. The trouble reading, the ADHD, the convergence problems, all those things are sequelae. So you need to figure out what the root cause is that caused this progression of symptoms to manifest itself in you. So rather than looking at just the convergence insufficiency, because that's the end part, you need to go back to the beginning. So let's look at some connections and see what we can do that may either resolve that issue, or if you need some kind of formal, say, vision therapy, make it so that you don't need as much of it. So I would say that's the end point, but what was the beginning point?
Got it. Okay. I like this question as well. This is from Sharon. How do the eyeglasses affect self-esteem?
Well, indirectly, what I would say is whenever you get your sensory systems working in unison, where you have a strong eye-ear connection, you can see that it will affect many parts of your life and it will build your confidence. Otherwise, when things are disjointed, your body releases stress chemicals. And so it's really hard to function. And that doesn't bode well for you doing what you have to do in a confident and reliable manner, a responsible way.
Got it. Got it. Okay. Next question. So This patient is actually an existing patient, her and her son. They both have ADHD, and um, her son has great challenges with the glasses. I'm struggling to, um, they're maxing out on the RX, and take some steps backwards. So I want to hear a little bit more about this.
Mhm.
She feels very focused when she uses her glasses, but her son seems to be having some some more challenges.
Okay. So now she didn't say how old her son is, so I don't really, it's kind of hard to answer that question. So I'm going to just answer in a broad manner that maybe her son is still developing, he's still growing, and so his brain is still changing. So she may be able to get her glasses and then keep them for a long time, where he needs to have tweaks along the way because his brain is changing along the way. For anyone who comes here, I would always say to them at some point is that this is a journey. And sometimes it's a one-stop shop, but not always. Sometimes you need multiple pair. And sometimes one person's brain changes quickly, which I know it's kind of inconvenient, but applaud to that person. And the other times, it just you don't need as many updates. So you may need 2 updates, you may need 3 updates, you may not need any up. Maybe one pair was the magic pair for you. But they're going to be ups and downs. It's sort of like the stock market. Sometimes you go up, 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 and then you take a little drop down and then you back up. But it's not always a straight line. But
Okay.
I'm happy that they've both seen success.
Yeah. Yeah. Okay. I'm gonna try to um, mix some questions here because some of the live questions and some of the existing ones that we have here are very similar. Um, so this one, it's a lot of people are asking about how the glasses help with reducing anxiety and how they can better read social cues, things like that.
Mhm.
Um,
So
how are they helping with that?
I know we're so accustomed to thinking of eyeglasses as a tool to help us see clearly.
Mhm.
I tell my patients all the time, I know that's how you think of eyeglasses, but we're using these glasses as a therapeutic tool to get your brain to work differently than it has in the past. So, with that being said, when you get your eyeglasses and you may put them on and go, darn, this isn't as clear as I would have liked it to be. It might be a little bit fuzzy because what we're doing is we're taking the light that's coming in through your eyes and we are dispersing that light away from the 20/20 area to the periphery, to some parts of the optic nerve fibers that are going to leave the eye, travel to the brain, and some of those fibers will end up going to the limbic area. And that's the area that houses your emotions, your fear, and your anxieties. So what I'm saying is that you have fibers leaving the eye that goes directly to the limbic system. And that can have a major impact on how you feel and your emotional state. And even to this day, that still amazes me how, how we're put together.
Yeah. Okay. Good. And then this one is again kind of a multi um, question to ask here is, people have talked a lot about being able to see things very clearly, acuity, and hear things, that acuity being very good, or both individually their visual processing or their auditory processing are good. Um,
Mhm.
can can a person have good acuity, good hearing, good visual processing, good auditory processing, but those not work together and have an effect on overall functionality?
Correct. The answer is yes. And I do see a question where a person is saying that her daughter has incredible visual and auditory acuity, but they're not linked together. They're working independently, so they're disjointed. So even if you have individual good skills, if they're not working together, if you don't have a good eye-ear connection, then that's not good. And it's going to impede what she's doing in some way. And in this case, every sound in her environment grabs her attention. Well, that's going to have a negative impact, even if she is a super smart person, because you want to be on that a continuum of attention. You want to be able to be in the middle most of the time. You don't want to be on one end or the other too much. So if you're hyper acuity, or you have, you're too much aware of what's happening around you, and you listen to every sound, and it really catches your attention and you can't stop it, how is that productive?
No.
It's not.
No. Yeah. All right, good deal, good deal. Trying to get as many of these in here as possible. Want to talk a little bit about, we've had a couple different ones asked in different ways. Um, the link in patients that have had a traumatic brain injury. It is that sometimes does it come off as a similar, symptom profile as somebody that has ADHD?
Oh
Um,
my gosh, yes.
yeah,
We see
yeah,
that all day long. So once you disrupt the connections in the brain, which you jostle them through a TBI or traumatic brain injury, you do get oftentimes ADHD type of behavior. It's just, I think there's this bucket of symptoms, and once you've had a brain injury, you can say, yep, ADHD, yep, light sensitivity, yep, sound sensitivity. Oh, I got the ear ringing. It's like, there's so many things that are similar.
yeah,
So
yeah,
yeah, and ADHD is included. Yeah.
yeah. Awesome.
And we do the same treatment with the mind eyeglasses, for example, and the activities that we send home, and the prisms if need be. We do, we still can help them, whether it's ADHD in its classical sense or as a result of a brain injury.
Yeah. Okay. Okay. And talking about that, similar situations, similar programs, um, you know, is the program going to be similar to or for patients who are adults versus children? We talked a lot about children in the webinar and the presentation, developing children for patients that have had an injury or who were diagnosed, late in life, being on the spectrum or with ADHD. Are we able to help them, and what does that look like?
The answer is we help patients of all ages, whether it's the older person. Here I go with another personal anecdote. I recently had a patient come in. He was in his 50s, and he goes, I'm here because my employees told me I need to get treatment for my ADHD. They can't take it anymore. And then you have a patient who brings her infant in because of a brain injury, and we need to do something to help the child who has a brain injury. And we do both using our patented techniques. So it doesn't matter whether it's from just pure ADHD in an adult and in a child, or a child with special needs. We still use our methods for all those cases.
Okay. Okay.
And we have to modify children. I mean, you can't do exactly the same tests on children as you can adults, but we still get to the same end.
Yeah. Yeah. Just changing up the methodology of how we get those results.
Mm-hmm.
Okay. This question we've gotten a couple times. I want to make sure we get to this. Amelia is asking, again, existing patient, her child. He just received his glasses for TBI and ADHD. He can only wear them for about 15 seconds so
Mm-hmm.
far.
Oh, that's a
Um,
good question.
yeah, well, will that make progress a lot slower? Have you seen the success rate for ADHD similar for someone who is also getting help with a TBI?
Okay, that is an excellent question. I'm so glad that she asked that question. So I think of wearing how patients wear their glasses as being put on a bell curve. So if you think of a bell curve, you have the two extremes. Some patients put their Brainwear glasses on, and from the time they put them on, day one, they never take them off. You get sort of like, oh, I sleep in my glasses. They're the best thing since bread. It's just wonderful. My life changed. And then you have most people who are in the middle. They ease into them, they gradually increase their wearing time, they get to full time, and they're off and running. But then you have some patients who are on the other end of that bell curve where they can only wear them for minutes a day or seconds a day, and that is enough. And to those patients, I want to be clear. If that's all your brain can tolerate, so be it. You can still have amazing results. So you just have to stay within the framework of what you're able to tolerate. That's fine. It doesn't make your chance of success any less than that first person who was off and running and, they're telling everybody in the world how wonderful their life is in an instant. So there's perfectly fine.
Good, good. I think that's a good transition into this next question. They mentioned that the journey sometimes has, ups and downs.
Mm-hmm.
What are some of the downs that, some people might expect? And how do we adjust? How do we handle for that?
Mm. I would say a potential down is, let's say you get your glasses and you love them. Oh boy, do I hear this a lot. I love my glasses. My life changed. And then all of a sudden, one day they stop working. I would say to that, your brain changed. Let's either help you via a Zoom by making a tiny tweak, or it's time for you to come back sooner. So I would probably say that's one of the biggest things is that a person is happy for 2 months, 8 months, a year, and then all of a sudden, without fail, they know as if it's so tangible, and yet it is intangible, that something changed. And I use that term that I saw earlier, another person used, a parent used. It's like a light switched on, well, then that light switched off. And that happens. And it's not a good thing or a bad thing. It's just an is, and it's possible. If it does, then we move on to the next part of your journey.
Got it. Got it.
That's probably the biggest thing.
Well, yeah. And ups and downs, but we work through them.
Ups
And
and downs, sometimes the person does have a bit of a difficult time getting used to them. And then, until they ease into them and off and running they go.
yeah, yeah,
They're it's another therapeutic tool.
yeah.
And
Actually,
and then one other thing I would say is
yeah,
sometimes a person will call and say, I can't see as clearly as I'm used to. Well, yeah, that's by design.
yeah,
We have to let that go. You have to be a little bit flexible. That's
yeah,
the other biggest thing.
yeah, yeah. Because acuity and processing don't always go together as
Hmm.
well. If
I
you're,
mean, and usually acuity isn't um, severe, like, you don't have a huge loss,
yeah,
but it could be different, a little different.
yeah, yeah. I like this kind of setup of questions on this because I think that it's a good transition from our last one. But the screen name is SRGOL. Talk about as the brain keeps adjusting. Is the prescription always changing, or do patients graduate from wearing brain glasses?
Yes, the prescription does change until you plateau, and then you graduate.
Yeah.
So, for example, I had a patient. See, here I go again with another personal anecdote. I just had a patient today, my last patient, in fact, and he was a patient for about 2 years, and then over Christmas he was in a motor vehicle accident. So now he's back, and even though it wasn't a big, huge accident, just a fender bender, his symptoms were so severe that he had to go on disability. And he had to come in, and in his case, we gave him new glasses, something called tear duct plugs, and he was fine. He's getting better. And today he came in, it's been 8 weeks, and all we had to do was change the filter on his glasses. He didn't need new lenses. So sometimes you need new glasses, and sometimes we adjust the glasses you have, and you don't need new glasses. It just depends on each case.
Yeah.
So yes, his brain did change, but in this case, the change just meant changing the filter. And they gave such a huge response. It was amazing. You would have thought that we made whole new lenses
Yeah.
when
Yeah.
we salvaged the ones he had been wearing.
Yeah. Yeah. And does it matter if the light that they have at home, is different from, the lighting that we have in the evaluation room?
No, that has not been an issue. Now, keep in mind that whenever we're testing our patients, we test in bright light and we test in dim light. We're checking the left side, we're checking the right side, we're moving the hips. I mean, we're doing so many different things. We're adding in auditory with the Z-bell. We're adding in proprioception. So we're adding in so many different things that we cover so many variables that by the time the person gets their glasses, they work under pretty much all conditions once they're accustomed to the glasses.
Right.
So the light in the home does not matter.
Got it. Got it. Um, SK says, their son will not allow and wear glasses. How do they fix that issue if a, patient refuses to keep them on? What's the strategy there?
Okay, so if we have a patient, and I'm sure we do, who refuses to wear their glasses, then we can try other means if it's possible. Other means might be using activities instead of wearing the glasses, or using prism goggles where you only wear them for seconds or minutes a day. Doing something called tinted lenses, syntonics, indirect syntonics, where we use colors and you don't have to wear those very long. So we found other ways because there are some patients who will not wear glasses. And let's think about it. What about infants who are constantly pulling their glasses off? We have to find ways to help them.
No, no. Yeah, just making adjustments. It's always adjustments
Mm-hmm. So
based on
you
the
meet the
patient.
person where they are.
Exactly. Good, good.
And I've had patients call or parents call and say, my child won't wear the glasses, and they definitely won't wear them to school. And my response is, let's not fight over this. Let's find another way. Maybe we can compromise.
I'm going to transition here a little bit. There's questions in regards to uh, homonymous hemianopsia.
Mm-hmm.
Um, and they're wondering if some of that could account for some of the balance and fine motor issues, as well as, do you think that is considered a processing disorder, or is it, you know, too biologic rather than functional?
In that case, it's biological. There's an anatomical change, a physical change that's occurred to the structure. So we have nerve fibers that have been damaged. So that may lead to processing problems. That's going to lead to balance problems. That's going to lead to motor problems, gross motor, fine motor. It's going to impact a lot of things, right? So you have part of your field that's missing because the tissue has been damaged. What we do in cases like that, all hope is not lost, is we have to maximize the remaining sight that you have. And to do that, we use a Brainwear prescription. We use prisms, either ground into the lenses or in the form of prism goggles. We use filters, this tape that's put on the glasses to block out the damaged pathways or dampen the damaged pathways. And what you can see or possibly see is some improvement in various areas. So what I do in particular, and I'm sure my colleagues, is we map out what you want to see get better, and then we come up with a plan to get you there and get you there as much as we can.
Yeah. Okay. Okay. Thank you. Kind of on that same structural, um, the changes in neurological function that are um, maybe more degenerative. What is um, what's our prognosis, and how much help do we provide for patients with Alzheimer's, Parkinson's, dementia, some of the memory and processing aspects, or some of the balance, posture, gait, things that come along with that.
Okay. I'm very conservative in cases like that. I never want to overpromise. You have to be very, very cautious, because when you're in that case, you're looking for a panacea, and there may not be one. So we can help you as much as we possibly can to maximize any remaining skills or healthy tissue that you have left, or healthy nerve pathways that we can get to. Sometimes that has a big impact, and other times a minor impact, and sometimes there is no impact. We can't help.
Hmm.
To the person who's struggling with Parkinson's or dementia, I mean, we're happy to help or try to help, but it's with caution.
Yeah, yeah. Can't stop the degeneration,
Right.
but we're helping with um, quality of life, I
Maybe we
think.
can help with quality. Thank you. Maybe we can help improve the quality of life,
Yeah,
even if we can't turn the ship all the way back around.
yeah. Okay, okay. Um, I think this is a um, let's see. With TBI and prisms in glasses, this patient said that they thought that they remembered Dr. Zelensky telling them that they'd need those prisms for life.
Mhm.
Um, do you think that's the case? Is it
Oh
a
my gosh, everybody's so individualized on that end. There's no, if Dr. Zelensky says you need prisms for life, you probably need them for life. But another person may need them for 3 months, even though they had a TBI too. So it kind of depends on the scenario. So maybe in this case, there is such a large strabismus that even though we can get the eyes closer together and help with fusion and getting you seeing single with the prisms, we may not be able to take them away completely. For example, last night I had a patient come in, and this physician fell and hit his head, and now he's strabismic. And so he has a lot of prisms in his glasses. And over the last 18 months, we've been able to reduce his prisms substantially. I mean, just amazing. But there's still a lot of prisms there, and he's going to need prisms for life. We had that very frank conversation last night. We can help you, and you're getting better slowly, but likely there's a likelihood that you're going to need these prisms for life, because the amount of deviation between where your eyes are aiming is just too great not to have the prisms. Now, that's not every patient. Some patients, we give them prisms and we gradually wean them off, and they're perfectly fine without the prisms in the end. Or maybe they don't even need the glasses at all. So again, it depends on the case.
in that would they going back to the LHH, the homonymous hemianopsia, uh,
Mhm.
is there a chance that we were able to get a person back driving?
So most states have criteria for peripheral vision.
Mhm.
So in a case like that, we have to map out how much field of vision they have. And chances are, unless they have some kind of special low vision device, they won't meet the criteria. So that's not always a given, David.
Got it. Got it. Yeah. So it just kind of depends on that. Um, I'm going to go back to one that's a little bit more focused on that the pen light and floodlight. So Nye asked, is it possible to have elements of both pen light and floodlight? Example, light sensitivity and peripheral vision, but inability to detect objects outside of foveal vision. Uh,
Yeah.
and this is their question is in regards to a person who is both on the spectrum and has had a TBI.
Oh, my heart goes out. So yes, it is possible that you can get stuck in either side of the spectrum. So yes, that is possible. But the good thing about the Brainwear is it does resolve it, or it can resolve both those issues, even if he's swinging back and forth and getting stuck in the extremes.
Yeah. Yeah. Just looking at, the rehabilitation aspect on that.
Hmm.
Okay. Um, let's see. I'm gonna try to go with one more here. This is actually back to SRGOL. And I know that we actually we talked about this in the webinar earlier about some of the previous things that it does not go to waste, the things that they've done before. But the therapy school that we were sending their child to actually sent their child to us because there was no progress during this year, and they're asking if the glasses would help boost the therapy that was already done.
Yes, so that is highly possible. I always tell patients that I know you've done a lot before you, because we're a last stop shop. So I know you've done a lot before you came to us.
Yeah.
And obviously you're here because your issues have not been resolved. So let's do what we have to do with sensory integration, build up the peripheral awareness, plus all the other things. And let's see how much of all this stuff you've done in the past comes to fruition and see how much of a holistic impact we can have. So all that stuff you've done in the past isn't wasted. I don't think it ever is. It's in there somewhere. We just got to figure out a way to bring everything together.
Okay. Okay. Well, we are a little over an hour here now. I want to be cognizant of your time and make sure we can get you back. I know you've had a long day of patients and things, so we really appreciate your time and all your knowledge and answering the questions and putting together this whole presentation. Really appreciate that.
Yeah.
Um, um, folks, if you have any other questions that we didn't get to, like I said, you can put them on the chat here, still, put an email with that, and then, or send us an email at info@mindeye.com. It's right here on the screen. We are happy to get back to you. We'll go through everything. Either myself or CJ or one of the doctors, depending on the complexity of the question. Um, really appreciate everybody that joined us this evening. I know we got almost 100 people in here today, and I have had a lot of requests already for recordings. We will have those recordings out to everyone. We'll send that out in an email as soon as that is done. Once everything gets uploaded, we'll send that out. And then that will always be accessible on both our YouTube page and our Facebook page. Again, Dr. Adams, thank you so much. Really appreciate it. You did a wonderful job, and it
Thank
was
you. And thank you everyone for attending. I'm glad there was such an interest in this topic. We see it so much and I hope you got something out of it. Thank
yeah.
you.
Hey, thank you. Really appreciate it. Have a good night, everybody.